We have Dr. Mahendra Bhandari, a renowned urologist and transplant surgeon with over 40 years of experience in India, who joined Dr. Menon and his team of robotic surgeons at VUI to focus on developing new procedures and managing the database, as well as improving the use of biostatistics in medical research. Dr. Bhandari is the CEO of the Vattikuti Foundation and the guiding spirit behind its program in India, and I invite him to propose the vote of thanks.
Honorable Dr. Montek Singh Ahluwalia, Raj and Padma Vattikutis, my friends Dr. Mani Menon, Naresh Trehan, Dr. Bhaskar Rao, Dr. Sudarshan Balal, Dr. Panda, Alex Motri, and distinguished, accomplished robotic surgeons and would-be robotic surgeons. Dr. Ahluwalia, your choice as the chief guest was not a casual one, because Naresh doesn't do anything until there is an appropriateness. And currently, Vattikuti Foundation has done its role in 11 or 13 months by bringing technology through private partners and bringing it down from $50,000 to $5,000. The rest is the job which we look towards you. Because the dream of the Vattikuti Foundation, the whole basis and mission is that economic disparities do make us to live different kind of lives. But in health, it is one of the most miserable situations. Even the poorest of poor should get the best of the medical care available. And that is the mission of the foundation. And the next phase is, how do we get to the public hospitals? When we look at the financials and business models, it doesn't work. It works if there is a commitment. So thank you very much for accepting our invitation to be here, and we are truly honored to have you here. I have to thank a lot of people, but always there are lapses in votes of thanks if you don't include anybody in the audience. But I must thank my two friends, Mani and Naresh, who really exploited my personal friendship for organizing this conference. I had access to their busy schedules in order to organize this event, which was Herculean. To shape a market where it doesn't exist is one of the most complex things, because most of the surgeons here said, we wouldn't have an access to robotic surgery in the near future to come. Why the hell we should come for the conference? So I think I'm grateful to them. I'm grateful to partner institutions who really generously supported this conference financially. I'm grateful to Intuitives, who were the main source of financial support. And the major support came from organizations like Kidney Care, Cornell, Vattikuti Urology Institute, through the efforts of Dr. Menon, to subsidize the participation of the residents. I would finally like to thank, though they are hosts, Raj and Padma, who really tolerated my esoteric way of thinking and supported the organization of these events. I'm grateful to a large number of faculty members and network people who, at a tremendous opportunity cost, accepted our invitation to mentor people in these institutes and are here today to really pass on whatever they have in terms of knowledge. I thank you, KWC, and I can't forget to thank my team in the United States with Teresa, Sarika, Nora, and Kriti Golcha, and my friend K. Subramaniam, who stood by me in difficult times for this conference. Thank you very much for your presence.